The federal government says it's working in developing Nigeria's first digital procurement and inventory management system for essential medicines in the federal hospitals, a landmark move aimed at tackling the persistent out-of-stock syndrome that has plagued public health institutions. The Permanent Secretary, Federal Minister of Health and Social Welfare, Daju Kachollom, unveiled the model at a stakeholder engagement in Abuja. Our correspondent tells us more on this story.
Nigerian hospitals have long struggled with irregular drug supply, forcing patients to purchase medicine from private pharmacies at higher cost. This model is coming at a time where over 70% of health spending in Nigeria is out of pocket, making drug shortages a direct burden on patients. Introducing the Nigerian's first digital procurement and inventory management system at a stakeholder engagement in Abuja, the Permanent Secretary Daju Kachollom explained that the framework aligns with the National Strategy for Supply Chain Management of Essential Medicine, recently approved by the federal government.
To discuss how, according to the objectives set by the DHS, how to strengthen service delivery by ensuring availability and affordability of essential medicines, to introduce the digitalized inventory consignment model for essential medicines in federal tertiary hospitals, to identify gaps and challenges in medicine supply chain, and to promote collaboration and stakeholders buy-in. Now, we have the PCN here, we have the Department of Food and Drugs here. You would discuss the modalities. You would discuss how everything would work itself out, the frameworks and how it will be. And that was why I sent for the officer in Food and Drugs to be sure that when the conversations are going on, it is in line with the National Strategy for Supply Chain Management of Essential Drugs, as approved by the federal government.
The Director of Hospital Services, Dr. Salahuddin Jimo, said the new model would cut out bottlenecks in the procurement process, lower costs for patients, and guarantee transparency.
So with this program that is really coming on board, it will help to reduce all those bottlenecks, meaning that when those bottlenecks are not there, the costs in between are not there, the price of drug will definitely come down. Secondly, the drug itself will be available. Now that we are talking about digitalized, liaising directly with suppliers and manufacturers, it means the medication will be coming direct. And since we are talking about electronic system, in real time, the information will get down to where the information is supposed to be. That look, we need this so, and then it will be supplied. Another area of benefit again is you cannot ask somebody to supply without making immediate payments. But in this model that they're bringing on board, the suppliers will supply.
Speaking on behalf of Chief Medical Directors, Dr. Eme Bassi, Chairman of the Committee of CMDs, called for model to incorporate social safety nets for vulnerable patients who often cannot afford essential drugs.
And would help you basically to improve your medicine availability, because at every point you have an inventory, you know what is on ground, and like you said, it would help to reduce all this expiration, because if you enter a typical teaching hospital and you see the drug store, some of them is as big as this hall.
Ahmadu Bello University Teaching Hospital has been using this model for almost 3.5 years, and the basic difference of this model from all previous models of procurement and supply of drugs to our hospitals is that in this situation, all the bureaucratic process of drug procurement by the institutions, that is the hospitals, has been taken out completely. Suppliers supply drugs, the hospitals keep these drugs in their hospitals. The staff of the pharmaceutical departments do all it takes to ensure that these drugs are dispensed to patients on a cash and carry basis.
The developer of the system, Dr. Emmanuel Okori, Chief Executive Officer of EMGE Resources Limited, described the initiative as the first of its kind in Africa.
So it's a co-creation thing with all stakeholders. We do not pretend to have all answers to the system, but we have created the system. It's innovative, it's unique, it's first in the whole of Africa, never done in any part of Africa, and we are confident that it will be sustainable and it will be successful because, number one, we have piloted it in the cancer space, and the cancer space has proven that this system works.
The pilot project is expected to begin in selected hospitals with plan to expand nationwide.